My name is Alexis Olson, and I'm a Master's of Public Health student at the University of Montana. Today, I'm looking at the ethical considerations regarding community water fluoridation in Hardin, Montana for my Ethical Issues of Public Health course. In July 2016, the Hardin City Council voted to discontinue community water fluoridation after a concerned citizen presented to the council that fluoride is, quote, an industrial waste poison that is hazardous to public health. Without consulting the local public health department or local oral health care providers, fluoridation in the town was discontinued. So let's look at the state of oral health in Hardin and other rural communities like it. Is fluoridation of the community water supply ethical and necessary in rural Montana? Due to limited oral health access, rural communities as well as American Indian communities in Montana suffer disproportionately from tooth decay. Hardin is no exception to this. Hardin is a small rural community in eastern Montana bordering the Crow Indian Reservation. Nearly half of Hardin's residents are American Indian. According to the 2017 State of Montana Oral Health Assessment, the rate of childhood decay in the state is 58.1%. That's just higher than the national average of 52%. The rate of childhood decay for American Indians in Montana is significantly higher at 92.3%. Due to difficulty recruiting and retaining oral health care providers, all children in rural Montana, regardless of race, receive fewer dental sealants and fewer topical fluoride treatments that can help to prevent cavities. Oral health and access to quality oral health care is a clear public health issue in the Hardin area, as well as in all of Montana's rural communities. While tooth decay is one of the most common chronic diseases among children, all ages are at risk of poor oral health and can result in diminished overall health and quality of life. One of the strongest protective factors against tooth decay is the use of mineral fluoride. Fluoride works to halt and reverse the demineralization of tooth enamel, which prevents cavities from forming. While there are multiple sources of fluoride, from toothpaste to rinses to topical gels, the fluoridation of the community water supply has proven to be the most cost-effective and far-reaching source. There's only one official risk associated with the use of fluoride, which is dental fluorosis. Dental fluorosis is the color change in enamel that results from ingestion of too much fluoride during tooth formation. This is not a serious health risk. Like Hardin's concerned citizen, there are many people that oppose the use of fluoride, claiming that it is a toxic agent bad for overall health. According to the CDC, there is no actual research evidence that community water fluoridation causes adverse health effects other than dental fluorosis. In fact, community water fluoridation is recommended by the American Dental Association, American Academy of Pediatrics, the U.S. Public Health Service, and the World Health Organization. When considering the ethical dimensions of community water fluoridation, we can consider the public health action's effectiveness, proportionality, necessity, impartiality, level of infringement, and ease of public justification. First, water fluoridation has proven to decrease rates of tooth decay in all ages by 25%, thereby proving its effectiveness. Montana's oral health data that was previously explained has remained unchanged for the last decade. The lack of improvement in oral health shows a clear need for a more systemic and proportionate public health action. The data also show that to take no action would perpetuate the disproportionate impact of tooth decay on American Indians and those living in rural Montana. While fluoridation of the community water supply does infringe upon residents that do not wish to ingest additive fluoride, this is the next necessary and proportionate action to take in order to realize the goal of reducing tooth decay in Hardin. Weeding out misinformation and providing proper oral health and education and fluoride information will be the best way to justify the addition of fluoride back into Hardin's water supply. As a result of my ethical deliberations, I conclude that it was not ethical to discontinue community water fluoridation in Hardin without the consultation of stakeholders and a more diverse portion of the population. I recommend that the Hardin City Council collaborate with the Bighorn County Public Health Department and local oral health care providers to deliver oral health education and expose fluoride misinformation. Hardin's community water supply should be fluoridated, and data should be collected to evaluate improvements in oral health. This data can then be shared with other rural communities that may need access to greater oral health care.